Welcome, everyone. Thank you so much for being here. My name is Kelsey Carlson, and I'm a child life specialist at Seattle Children's with the ambulatory clinics. During the week, I support there, and then on Saturdays, I support with inpatient needs. And my name is Maddy. I am also a child life specialist. I work in the radiology department. So we are going to jump right in and kind of talk about coping with some common procedures here. We are going to go through kind of what child life services are, what we do as child life specialists, and what you can do to request a child life specialist when you need one, and then kind of go over a few different tips and tricks for these different procedures, have a little bit of a discussion and Q&A time, and then we'll let you guys know kind of the general resources and contact information for a child life. So what is a child life specialist? We are healthcare professionals with a background in child development, psychology, family systems, things like that. We help patients cope with the healthcare experience in general through play and preparation and education, self-expression activities. This can include different things for different kids. A lot of times that kind of looks like medical play to normalize and to increase understanding of different procedures and diagnoses, and then just overall coping support. We provide a range of emotional support and encourage healthy development of children who are facing a range of challenging experiences related to healthcare and hospitalization. At Seattle Children's, we have about 40 child life specialists who cover all these different areas. We have child life specialists in the inpatient unit, including the medical unit, surgical unit, ICU, cancer care unit. Outpatient, we have people in the surgery center, in the radiology, emergency department, and our outpatient cancer blood disorders, infusion, and bone marrow clinics as well. We also have child life specialists in the main campus ambulatory clinics, including dermatology, which a lot of you guys are probably familiar with. And then we also have people at our regional clinics, including Sandpoint Clinic, North Clinic, South Clinic, Bellevue, and then Odessa Brown Children's Clinic as well. The hours can kind of vary between those places, but we do have staff in all of those different areas. When should I request a child life specialist? These are some of the times that a child life specialist can be helpful for families and patients when they're kind of encountering these different healthcare experiences. When you are preparing for a procedure, sometimes it's helpful to have a child life specialist present to help explain things using developmentally appropriate language in a way that kids can understand, to help with their understanding of what's going to happen. And then we also are here to help kids cope with the procedures during the actual procedure itself with procedural support. Kelsey will kind of get into some different ways that we can do that a little bit later. If kids are having a hard time coping with either a new diagnosis or pain, different pokes coming to the hospital, any of those things are good times to ask about child life specialists and how we can support. For coping plan development, we work a lot of times with kids to help come up with a plan after we've discussed kind of what the needs are, coming up with a plan for during the procedure to help them cope with whatever it is that we need some support with. And then advocacy for the patient, the family, and then that also kind of looks like sibling support and education as well. We know that when kids are in the hospital or dealing with healthcare experiences, the whole family is impacted, so that includes siblings as well. And how to request a child life specialist. So when you are scheduling appointments for your child, you are more than welcome to mention during that process, hey, we would really love to have a child life specialist present. You can explain why or just be a little bit more broad, but if your child is anxious, has questions that you maybe are unsure about how to address, that's a great time to ask about that. You can also request from your provider. They can place child life referral for a virtual appointment or for a appointment support. So if you've had a tough experience in clinic or in the hospital or full conversations and you want support after the fact, that's also a good time. So an example would be to discuss pill swallowing or coping with some injections, things like that, that we are going to be happening at a specific appointment, but it's going to be addressed at a virtual time. And then in the moment support, also more than welcome to request your provider to let child life know that we might be needed. In the moment, we're happy to try our best, although we do
try to set the precedent that we're not always available in the moment because we may be with other patients, but we're always willing to try our best. If you're doing a walk-in blood draw, it's always helpful to call beforehand just to kind of set up a appointment with us, even though the lab is walk-in. We, like I said, we're kind of all over the hospital, so having a little bit more information beforehand is helpful. And then you're always welcome to give us a call at the end. We'll have the phone numbers that we'll kind of give out so you know who to call, but you're always welcome to give a call and just let us know that, hey, we're having trouble with this. We'd love to connect and kind of talk about different ways that we can help.
So now we'll kind of talk through some of the things that go into coping, and then we'll move into talking about how to create coping plans and kind of give some examples of what those can look like. So first and foremost, we really like to start by thinking about coping style, knowing that these can change from day to day, from moment to moment, from procedure to procedure. Sometimes kids or people can be watchers, and so that's where they want a lot of information and they want that step by step of what's happening. They may want to watch the procedure. They may want to be the one who gets to make those choices about how things happen in the order of things happening. And usually they kind of want to come with us. And then we may have people who may be more avoiders, where distraction is more helpful, and they maybe want more information in the moment of what's happening and just to kind of focus on their things. So for these things that can be helpful is minimal information and just kind of comfort positions. We'll talk through some of what that can look like. And then sometimes people are in the middle of, like I said, it can change day to day, from moment to moment. And that's just something to be helpful though, as we are talking about coping, that this is something that really impacts how we make a coping plan. Next is choices. So really just being intentional and mindful about the choices that we are providing in these moments, and making sure that they are appropriate choices. So instead of saying, time to take your medicine, okay, really changing that to say, take our medicine now. You want to take your medicine in this spot or in this spot. You want to take your medicine with juice or with water. And so finding appropriate choices work within that. And then comfort positioning. This can be really beneficial, especially for younger children, but honestly for all kids, depending on the need. It really creates emotional safety and just kind of a comfort in the moment, while also allowing a procedure to happen safely if we make sure that everything is kind of set up. I'll flip through some pictures because I think that's the most helpful about it when thinking about it. This is a common comfort position for IVs or blood draws. The child is kind of relaxing and caregiver. We have the arm out available and safe where the caregiver can kind of help hold it still. And then the legs are safely covered and being held in a way that's not restricted, whereas if we were just holding down, it may not feel as safe. And then another one, just for kids who benefit from kind of avoider or distraction, where they can kind of turn away, either turn into the caregiver for a hug, or maybe have distraction on while still coming on. Another component of coping is numbing agents, especially for IV blood draws. Numbing can be really helpful. We will send this whole presentation out, and all of these are linked with the numbing cream. Will take you to a handout that talks about how to get numbing cream and then how to apply it properly so that it's most effective and where to apply it. And then for injection, numbing cream. Welcome. Right now we're just kind of going through some of the different pieces that go into coping support. So for injection, if numbing cream is helpful for blood draws, sometimes it can be helpful for injections just for that choice and that control, but typically the numbing cream only not that their skin. So it's not as effective for injections, but again, it's that control. So it finds that helpful, then that's just another tool to fit. Other things that we personally utilize and really effective are ice packs, shot water, and the humidity for just like a gentle massager. Our team, these are not hospital sanctioned pharmacological tool, but it is something that you can access and on your own by like Walgreens or wherever you find something like that. I think my understanding report is really beneficial. The shot popper or to basically use the beam signals to the brain. And so that's a very simplified version of it, but it can be helpful to just kind of add another stimulus so that we're not focusing on that shot and redirecting that focus elsewhere. So now we're going to jump into our discussion, and I know we have some people here in person and we have some people here virtually, so we'll do our best to kind of toggle between. But we just ask that during this time we all stay engaged and practice active listening. The questions, this is our time to really work together and learn from each other and be curious. And we'll do our best to honor our time and kind of go quickly. And I'm very passionate about this, so and Maddy will be our helper. You're great. And Sophie, we have you on, on our chat. Perfect. So kind of all of those things go into building a coping plan that I just talked about. Others that can be helpful are distractions, so thinking about what distractions. For some kids, having something like maybe start playing and super helpful and distracting, and other kids, it's really heavy and almost distracting. So as we're kind of being really mindful about and that's helpful for them. Also, incentives, making sure that we're thinking about the sustainability of incentives. It can be really nice to want to get rid of prize for doing, completing that procedure or doing it effectiveness, and maybe finding other ways to use praise or have a checklist, something that works for you. Another tool that can be in this is medical play, where you yourself first or showing that first yourself or and then again it's just a workshop triggering and kids, especially younger kids, developmentally, it can be really hard for them to have that connecting to words. They may not have the concept of them yet, and so just being really mindful about how we can using shock injections, or instead of using burns, maybe using like burns really long and they last a long time and they're very simple, whereas if we do something like about that. All right, so first we have blood draws that we're going to kind of use as our discussion tool. This is an example of baseline, probably heard of these people in person with us, but this is basically a tool that breaks down all of those things we just talked about. So what are we going to do as distraction while we wait? What are we going to do for that comfort positioning or sit with someone? Are we going to sit by ourselves? Do 100%? How do we do so I would open it up and see if we have brave people who would be willing to share some strategies that are helpful to their child. They had a blood draw, or maybe we haven't had a blood draw yet, and that we're worried about.
Well, with my daughter Emma, at 14, I'm still holding her hand, and she and I get each other in the eye, and we just start breathing. Both do feeling breathing in through our nose, through our mouth. We looked at each other, her dad showed something to make her smile, but not move too much, and we just go through that, and we'll usually feel it. Right? Don't look at that. You don't have to worry about it. So, yeah.
Thank you for sharing. That's really helpful. And to know that it sounds like it's maybe helped over time. You have a plan in place. You know the routine once you get to that.
Yep. 7 years of that. So, yeah.
And she does like to communicate with the nurse ahead of time that she likes to have a countdown to that. So 1, 2, 3, and then it goes in. Doesn't like to just be surprised with the team. So always have have a countdown before that.
And knowing those things that you can't actually have in the moment, how to provide those.
Well, I think
Take
the
it for
introduction-
free, but after that.
And the introduction of knowing, you know, hey, this is our nurse, so and so, and this is Emma and Dad, and we got. Yeah, it's like every day.
We also have Emery David in the chat has said that what she does is distracts her son with conversations, like asking questions about his favorite football players and their stats.
Perfect. I love it for engaging that thinking part of the brain and also teacher. Thank you for sharing. Good luck on the future. We'll have. All right, next is eye confusion. I know it can be similar to blood draw. If we want to use medication, things that will help during the IV. You know, for some kids, it can be really difficult. Just that anticipatory anxiety, their kids can be really difficult. And so really needs to be kind of factor coping style and you know, what are going to be some of the challenges and we have any examples like to share discussion about IVs and how we can help support with those. So you can me and my audience that
So my daughter, she just started this week actually, probably youth center first. And I mean, generally she like know what's coming out. So, everything that she know about. That we're trying to deal with right now is getting it. So gotta get back up. How everybody handles that, not just the procedure.
great question. Does anyone, did we think online they were able to chat or maybe you could type that in the chat?
No, Emery, also once again, for IVs, we've started to incorporate IV hoodies, which are helpful because it doesn't have to be the IV on the neck.
So that is not being here.
Oh, cool. Whenever I get to the down to the infusions, we try to make it kind of like the date in a way. So, you know, we bring maybe the switch or a couple of Xbox controllers. Maybe she'll bring her stuffy, but like if she gets into that recliner. All right, let's get you loaded up with those heated blankets. Let's get super duper cozy. Take off the shoes. So we try to make it fun as an infusion or IV. And then she might just pull a game, right? But you know what? It's so we're together, and we know afterwards that we're going to go do this or that. J-tips have always helped for Emma in terms of the numbing medicine, but she also has difficult pain, which the J-tips don't agree with. Lots of impact and, you know, try all the different areas. And since Emma's been doing it for so long, she's able, like Sarah said, to communicate with the nurse. Say, hey, you know what? We usually get a really good here, but I don't like it. So, you know, that self-advocate. It's been really good. But, you know, she's a little bit older too. She's learned that.
The other day, come back to you, they exactly like those side effects for that. For the one that'll kind of fade over, I know she's got.
It's supposed to feel like a beat, but almost. That's, you know. I know that that's built up time. Next one.
She's already expecting it.
This one.
Think if it were my child, but like what I, like, maybe make a plan, like, oh, let's make sure we have like special blanket, unit, it's gonna be key, but we've got the Tylenol or Narcotin or whatever, and it's not, like, if they, okay, what's your favorite, laundry or like, prep ahead of time that, it'll be like extra cozy and extra comfortable, and I would even get like, don't worry about school. Like, but just kind of prep her ahead of time, like, the focus is her, making her feel better, and not to worry about, doesn't mean that she'll feel bad, even though she'll probably feel pretty crappy, but that you're gonna do everything.
You know that yours is the stronger medication than Emma's been on, but the first one Emma was on was quite strong on June. I don't want to say she got used to it, but I think three of us and her siblings and all have kept going with that plan, so she knows exactly what to expect every time. And it comes to that routine that she discovered. And as much as was the side effects after the infusion, it started tapering down as that'll have, there's that too. So I mean, we try to get optimistic thing. This stinks right now. There's no doubt about it. You know what? These few days of feeling crummy might feel a little bit better, right? Your bones may not hurt as much, your bone may not be affected as much. Let's see how it goes. And we keep giving it the opportunity. But we also give that a voice to
Also, we have to prevent years ago. For and so in the hospital, we can start having just to be helping her and walk. Everything that it doesn't make it so good.
You could like put a plan together with kids, not today. I mean, parents already have a plan.
sometimes the parents figuring out the plan. Yeah, they do well.
Thank you for the call to me so much. Go ahead to our next one. Take it.
I guess, I think 10:55 is the perfect.
So next is something with injection. That's all of our slides take your full back. Link attached to their article. But the patient fiddle like that. This one is on reducing and some of that strategy to support with that. Coping with injection, there's going to be a lot of blood draw. This is just another format, so our idea kind of was that you have this presentation now, so these are a bunch of different coping plans that you can kind of for those in person. But again, it's funny to those choices of numbing cream. Do we want to know what's happening on the leg? Mindfulness tools that we can realize to help in that. People that this is probably more common.
Right.
Sometimes that can be effective, like if we do this, then
Usually they know something special.
I'm going to Disneyland for break, yeah.
Yeah.
I like all the pre-planning, because I'm a planner myself, like, I like to know what I'm going into, getting into. So having those books, I was just scrolling through some of them, and that could help your kiddo understand, okay, hey, look at this room, this is where we're gonna hang out, and this is what it's gonna be like, and there's gonna be this person helping us, this person. And giving them the same tools, though they may not understand all, we can help explain them. And I know I feel better going into the situation the more I know about it, right? So why wouldn't you know?
Usually they can post so much better.
Yeah.
And I will say for incentive wise and like thriving, when we have those kids who are young enough that it's hard for them to conceptualize this is like whether uncomfortable, painful, it makes me feel sick. And they aren't able to recognize the like benefit long term, just developmentally, that's hard for them. Sometimes that's when we do lean on some of those bribes where it's not, later down the road, this maybe painful procedure will help you physically. It's easier for them to conceptualize this painful procedure then leads me to then I get this goal, whatever it is, incentive or time or whatever. And it can kind of bridge that gap while we're developmentally gaining the ability to see that long-term goal, which is hard. It's even hard for adults to see the long-term goals. So we expect a lot of the kids.
There's one point where I can never try to catch him Friday. One, go out and
Oh boy.
good shot. Good boots. Over.
So I actually do have a question from online.
Great.
Thank you, Jen and Marie. So we have for our question the anxiety for our son's 12-year-old son's injections is related to the anticipated nausea he experienced after. You tried Zofran. Anyone have any tricks or tips to help combat the nausea?
This is one we care about a lot. For the nausea as a symptom, we usually tend to do that towards the care team. But it sounds like it's Zofran being used. That maybe is from the care team and not kind of that quick. We tend to see it very frequently, unfortunately, but the more control, the more choice, the more empower kids in the injection process, we tend to see that. And so finding ways to incorporate them, whether that's like hand over hand, if that's to help with the injection, sorry, I'm like talking to you.
Okay, take a note, David.
Hand over hand in the sense of giving that control or letting them choose where they want to sit for the injection. Do they want to sit on someone's lap or next to someone? Do they want to use any of those non-pharmacological pain tools like Buddy or Shock Walker, and just really helping them to be in control and feel like they can.
Is it nausea from anxiety, or is it nausea from the ICU or lift? And you'll find it more anxiety because they're,
Well, they might be able to try it every time something, but not like the peppermint essential oil at the time, so the kids will smell it, knowing that it can help with nausea to begin with, but doing it before the shot might kind of trigger what's the term, just kind of something, it's not gonna hurt them. It might help, might not do anything, but at least that they would be like, this is helpful. No. Right, kind of use it a little, so it might give them just something enough of a, like when you drink maybe cold water. That kind of stuff. Might be just something to try like that, or having, ginger tea or something, simple to try it a little bit before and then after. Something. We when my daughter was first diagnosed, she got it just for vomiting from seeing the bottle at the truck. That's what triggered it, and we figured out. So that didn't, we were not able to do that. Yeah, but we had to try a lot of things. So.
I've heard peppermint before. I've also heard sour wort. They'll put them in right before it happens, and then sour.
I'm sure gonna mention that too, the sour warhead, sour gummy bears, something like that. Again, like the water shocking, it tricks the brain.
All you focus on is that.
Yeah.
A little more.
It's a little
Also, you take that sour warhead yourself with the kiddo, and they get to see your. Right? They'll be laughing
True.
instead of focusing on.
Any questions on mine?
Yeah. Good thing that that's about it.
Mm-hmm.
Back when she's got roots. Keep fighting. Her.
And you'll notice sometimes when we're talking to kids, we'll say things like, some kids tell me it feels like this, or some kids tell me it feels like that. Maybe you can tell me so then I can talk to other kids. And I find that kind of giving them a job and a role can also help. And it, like you just said, it's kind of like, oh my gosh, I'm not the only kid going through this. You just said that other kids say it's like this. So kind of just even without having, if you don't have like a physical person of, look, this person's also going through it, just again, being mindful of the language and using that sort of to bridge that gap as well.
That's actually here.
That's awesome. That's great.
All right, the next procedure is MRI. This can depend on developmental age, but also just how much experience they have in the hospital. Sometimes we do MRI super successfully, and then we just hit a wall where we're like, not today. So, you want to talk more than just
Sure. Yeah, Dr. Radiology, I do a lot with MRI. Some kids do them with anesthesia, some do them awake. Sometimes we see kind of a gradual situation of we're doing it with now we're working on trying to get to doing things awake. But kind of the typical options we have are distractions during the actual MRI. We have these, and we have both music, and we have the new building of Children's Hospital that has the fourth section in there, so Netflix, their cameras extra. You can watch whatever they want. I know. And so just having that as a way to have the distractory is a great option. And then having a caregiver in the room is also helpful. We see a lot of times have like a hand on the foot, and on the arm, whatever is accessible. Starting it away. And then again, just prepping kids beforehand. We have some QR codes and they have some videos about what to expect when you get an MRI. One for doing it awake, one for anesthesia. And those can be really helpful because I think a lot of times, from my perspective, what I've seen families come in and a family member has had an MRI before. For grown-ups, we sure don't get all of these treatments like getting to watch a movie and having to be in the room with us. So I've had parents be like, I just don't think that this child is going to be able to do it awake because if we had them do it awake in the way that adults do it awake, they probably wouldn't be able to. But there's good resources to kind of see the options that we have available instead of just doing it as adults do, which is tell you to do it. So yeah, those are helpful, and then letting kids know what to expect as far as like hearing the noises that the machine they have some movie going on, some of that. The video actually has it plays the noises and then it plays them how they'll sound with the movie that comes on, which is nice. And then just a little coping toolbox about things that we can do for the air itself during it starts to have moments of anxiety, breathing, counting, imagining their favorite place, and there's some blank spots that surround. Sometimes kids have questions that I typically just thought about. the actual tunnel going to get smaller and smaller and smaller and eventually like touch me and push me? The answer is of course no, but there's these specific little questions that often is fill in the blank when we don't get them information with things that are superior than in real life. So just asking, what questions do you have? What words do you have? Give a lot of information about kind of how they're filling in those blanks.
Any tips or tricks for MRIs or experiences?
He lucked out.
Yeah.
He's been doing them a week. Last bitch. Hopefully we never have to talk her out.
The full body MRI, so we're in there. Tip for a parent who's gonna be in there.
Bring a book.
Bring a book.
Bring a book.
Website of the last MRI tells you that magazines after about the last 5 years were actually refreshed. So, you know, yeah, do something for yourself as well. In the one.
Your plug.
Oh, yeah.
I think you need to prep parents if you do go for the MRI with anesthesia. If you've never seen your kid go under anesthesia.
Oh, yeah.
They like do your thing.
It's a different experience for sure. Yeah, watching it for the first time. We always hope that the care team kind of goes over what to expect, but we also know that our role as child life specialists is to be aware that sometimes these other members of the medical team don't have that background in the psychosocial and developmental aspects of everything. So try to bridge the gap as well. But yes, that is a great call out.
It looks like they're having confusion. They're just going to sleep.
And the doctor's like, oh, it's normal. It's normal.
Yeah.
It doesn't look normal to me.
To watch.
It is.
Once again, Anne Marie has given us an idea. Thank you.
Great.
It's honestly MVP. So one of the things Anne Marie suggested was letting the kids see the head cage and what that looks like before they go in, and sort of letting the parent see it as well, so they feel more comfortable with why they go over my child's head. Especially explaining how it works, why it's necessary. So yeah, 3.3.
We're in the process. I'm trying really hard to we have a great therapeutic gaming team, and we're working on making a 3D printed head coil to showcase beforehand. So hopefully that'll be something that here is in the future.
Are any of those things available for us to show the kiddos at the time of the MRI? Like, hey, this is what we're gonna do. I know they're just getting so tight.
I know. Great question.
Time is the
Yeah, great question. It's always worth an ask to the MRI team. But just like you said, they do have a very strict schedule that they speak to, which is why I think it'll be really helpful hopefully to have these resources like that. If I stretch for time, I often just like quick Google, like, hey, this is what it looks like. And in the video, you can see the head close for like half a second. So I have it paused on that and I try to show them. But yeah, I do think seeing that ahead of time is helpful. And it's something that we're in the future hopefully gonna have more options how to do that.
We have like 3 minutes. Right. So maybe we'll just pause here. Knowing pill swallowing is probably one of the more difficult pieces of medication compliance. But again, with everything, it's all those choices. And I'd like to hear the support and talk through the plans and kind of talk through strategies and tips and tricks, kind of have our own toolbox that we try and have tried and learned from other things. So here is a resource. You want to switch to our, oh yes, sorry. We have all of our information for regional sites. If you're coming to any of those clinics, I'm not going to basically any clinic, lab, rheumatology, any of those. And then also regional sites.
Are you guys available outside of their appointments? If they have questions?
Over the phone,
Yeah, we can call. Okay.
or if you're at the hospital for an appointment anyway,
Yeah.
and you could always let your team know, hey, we're here at the appointment. We don't have concerns about coping with this specific appointment, but if somebody's available to come while we're already here and like be in the waiting room or whatever it is, and we can have a quick conversation, or you can set that up ahead of time. Hey, we're going to be at the hospital anyway. Can we set up like a however long, just like chat in the lobby for about a specific thing or for the phone? Yeah.
And Emma loved the child life specialist. I would come see her every month for years. And I really helped, not only her, but Sarah and I out as well.
The whole family endeavor.
And then these are just links to additional books on the preparation versus on your age, for you. And then more helpful links. Lots of resources and tools will all be independent.
That's it.
We have one more question. But if you have questions, we are.
Thank you, everybody, for sharing all the really helpful. You guys have a wealth of knowledge and information that we don't have. Just living out the experience. We see it from the clinical side, but you guys have all the experience. So that's also very helpful for us to know as well, to kind of use in our toolbox.
And for other families. And thank you, Anne Marie.
Yes.
Sorry, we were virtual.
Yes. Thank you, virtual audience.
Thank you all for attending. We'll be wrapping up these sessions shortly. You'll be able to take a quick break and go on to the next. Folks want a refresh on what you might be able to see and recognize on the paper, but let's tell my boss I did my job. So we have transitioned from the patient perspective, and this is the most significant transition into adult care, advocacy and accommodations, and coping with common parts. That was us. Pain management are under, as well as insurance. So read check. Probably any last minute questions here.
Thanks. Thank you, everybody.
Thank you.